Does it feel like there are no good treatments available for patients with Hashimoto's thyroiditis? It's not in your head, it's the truth. Despite Hashimoto's being the most common cause of hypothyroidism in developed countries, there are very few treatments available for this condition. Before you get worked up, let me explain. Yes, we have treatments for the thyroid dysfunction aspect of Hashimoto's thyroiditis in the form of levothyroxine. But what I'm talking about here is that we don't have any good treatments for the autoimmune aspect of Hashimoto's thyroiditis. And it is well known that the underlying problem in autoimmune disease, any autoimmune disease by the way, is the immune system. If you can slow down the immune system and slow down the damage that it is causing to its target tissues, you can effectively put that autoimmune disease into remission. This is the approach that doctors take for just about every autoimmune disease except Hashimoto's. In Hashimoto's, doctors focus primarily on the thyroid instead of the immune system. And this leaves patients in a difficult situation. Should they just let their own body attack and ultimately completely destroy their own thyroid gland? Or should they try to do something with their immune system to stop this? Unfortunately, there aren't many good options available from your doctor outside of off-label medications like low-dose naltrexone. But this doesn't necessarily have to be a problem for thyroid patients like you listening to this, because of incredible natural treatments like black seed oil and Nigella sativa. It may sound too good to be true, but it's not. These treatments can actually work, and I'm going to use some research studies to prove it. Let's talk about how Nigella sativa changes the game for patients with Hashimoto's thyroiditis. First, let's talk about what Nigella sativa is. Nigella sativa is the name of the plant that produces black seeds, which can then be pressed to create black seed oil. And this plant and the many bioactive compounds found inside of it have been shown to have very promising effects on both the thyroid and the immune system in patients with autoimmune thyroid disease. A placebo-controlled trial highlights this point perfectly. It showed that patients taking Nigella sativa for 8 weeks experienced improved thyroid lab tests, reduced VEGF levels, and even experienced some weight loss. Do these sound like the kind of results that you might be looking for if you have Hashimoto's? If so, then I think you'll find the breakdown of this study very beneficial. Before we break down this study, there's one thing I want you to be aware of. The study that we're about to discuss highlights the benefits of the plant Nigella sativa. The same beneficial compounds found in Nigella sativa are also likely found in black seeds and black seed oil. So it's reasonable to assume that many of the same benefits we're about to talk about when using Nigella sativa can also probably be realized when using black seeds and black seed oil. And this has been my experience as well as the experience of many other patients with Hashimoto's. I would even go as far as to say that black seed oil is superior to Nigella sativa because you can individually control the concentration of the ingredients found inside of it. But we'll talk more about that later. For now, let's talk about the study and how Nigella sativa benefits thyroid patients. Number one, it has a pro-thyroid benefit. Probably the single biggest benefit here is that it's been shown to have a positive impact on thyroid lab tests. As you well know, Hashimoto's thyroiditis ultimately results in the condition known as hypothyroidism because of the damage it causes to the thyroid gland. This is the reason that patients with Hashimoto's ultimately end up feeling so poorly. Low thyroid function causes things like weight gain, hair loss, fatigue, cold intolerance, constipation, and the list goes on and on. These symptoms occur because your own immune system is slowly destroying your thyroid gland. And when this happens, it can't produce the thyroid hormone that it needs to. The use of Nigella sativa may be able to counteract this negative side effect. One study showed that 20 thyroid patients who took Nigella sativa for 8 weeks experienced a drop in their TSH by about 2 points, an increase in their free T3 level by about 0.15, and an increase in their free T4 level by about 0.8. The average starting TSH in the patients who were tested before taking Nigella sativa was at 6.42, which then dropped to about 4.14 after 8 weeks. This may not seem like much to many of you listening to this, but it's actually a big deal. These changes occurred in these patients without taking thyroid medication at all. In this context, this suggests that Nigella sativa has a pro-thyroid benefit that may be equal to a small dose of thyroid medication. Benefit number two is that an immune balancing effect. The 20 patients I mentioned previously also had a starting thyroid peroxidase level of about 294. After about 8 weeks of taking Nigella sativa, this number dropped from 294 all the way down to 147. This represents almost a 50% drop in their antibody level. And again, this is a huge drop considering that these patients didn't use thyroid medication and didn't use any other treatments like diet or lifestyle changes. Had they combined these treatments with the Nigella Sativa, they probably would have seen an even greater drop in their thyroid antibodies and an even greater improvement in their thyroid lab tests. Benefit number 3 is that it reduces VEGF levels. Don't overlook this benefit because it's more important than you might think. VEGF stands for vascular endothelial growth factor, and its primary job is to increase blood flow by increasing blood vessels. This may not sound like a bad thing because, after all, you want more blood flow to the thyroid gland. Even though this is true, you don't want too much. It's been shown that patients who have Hashimoto's thyroiditis have higher levels of VEGF than people who have healthy thyroid glands. This is an issue because we also know that VEGF is associated with higher rates of certain types of cancer. This probably explains why patients who have Hashimoto's thyroiditis have a higher risk of developing thyroid cancer compared to those with healthy thyroid glands. So reducing your VEGF levels is important if you want to reduce your risk of thyroid cancer as a patient with Hashimoto's. The good news is that the bioactive compound found inside of Nigella Sativa, known as thymoquinone, appears to do just that. This benefit is most likely mediated through its anti-inflammatory and anti-cancer effects. Are you interested in using Nigella Sativa if you have Hashimoto's? Before you do, here are a few things you should know. The study that I've been quoting from here used Nigella Sativa at about 2 grams per day as the therapeutic and effective agent. So if you're trying to replicate this study, that's what you'd want to go and do. But I'm going to recommend that instead of using Nigella Sativa powder, you consider using black seed oil instead. Here's why. All of the same bioactive compounds found in Nigella Sativa can also be found in higher concentrations in black seed oil. It's easier to concentrate the bioactive compounds in black seed oil compared to Nigella Sativa, which often means that you need less dosing in order to get the same benefits. Another benefit is that you can standardize the active ingredients in black seed oil, but not in Nigella Sativa. And finally, the bioactive and beneficial compounds found in Nigella Sativa will vary from plant to plant, depending on where it was harvested, the type of soil that it grew in, and other factors outside of your control. Using black seed oil, on the other hand, allows you to get many of these benefits while using a smaller dose. But even then, black seed oil isn't perfect either. Here are a few things to consider before you pick out the type of black seed oil that you want to use. The first thing you want to ask yourself is, what is the concentration of the active ingredients in the black seed oil that you're looking at? What's the concentration of thymoquinone, P-cymine, carvacrol, and free fatty acids? And are these doses standardized or not? The second thing you want to look at is the concentration of omega-6 fatty acids. Does it have a high level, and are these levels accounted for? The third thing you want to look at is the dose. In other words, how much black seed oil are you taking every day? And finally, you want to think about how your black seed oil was created and transported. In other words, is the quality of black seed oil that you're consuming high, or is there a risk of you getting a rancid product? I spent a lot of time researching black seed oil for the purposes of helping patients with Hashimoto's, and here's what I found to work the best. Aim to take a dose of about 1,000 milligram split up in 2 500 milligram increments every day. Use a black seed oil that has at least a 3% thymoquinone concentration, but no higher than 10%. The reason for this is you get diminishing returns on this beneficial ingredient once you get above that 10% mark. Next, make sure you find a black seed oil that accounts for the free fatty acids found inside of it. Higher levels of omega-6 fatty acids can blunt the anti-inflammatory effect of the thymoquinone. For the highest anti-inflammatory potential, here are the standardized doses that you want to look for. Thymoquinone should be around 3 to 5%, P-cymine should be around 1%, carvacrol should be less than 0.1, and you should aim to get less than 2% of free fatty acids. If the black seed oil you are using makes no mention of these, it's probably not a very good product. And by the way, you can also combine black seed oil with other ingredients which can augment its anti-inflammatory potential. Studies have shown that taking black seed oil with vitamin D3, pycnogenol, and lutein can all enhance this anti-inflammatory benefit. Whether you decide to take black seed oil or not is totally up to you. But if you do decide to take it, I would strongly recommend combining it with dietary changes. Combining dietary changes with supplements like black seed oil will dramatically help improve your symptoms and may help further reduce your thyroid antibody levels. If you want to see how to do that, I'd recommend checking out this video next.